So, what is the correlation of hormone imbalance and getting pregnant? This is the topic we're going to discuss. We've been talking about hormone imbalance, and fertility issues are so rampant all over the world now. So, and how does this hormone imbalance impact it? That's what we've been talking with a naturopathic doctor, Dr. Shadi. So, hang on for 1 second until she joins me. Kind of things we will talk about is that hormone imbalance, issues with the pregnancy. Hello, Dr. Shadi, how are
Hi.
you? How are
Hi,
you?
how are you? Thanks for
Good.
having me.
Yes, absolutely. So I was just telling your viewers the topic is the correlation of hormone imbalance and getting pregnant. And
Mhm.
and you are a naturopathic doctor from Canada who specialize in women issues. Maybe tell us a little bit why you specialize in this particular area, and then we will go into the hormone imbalance after that.
Yeah, so hi everyone. My name is Dr. Shady Tabaei. I am a naturopathic doctor and I help women balance their hormones and get pregnant. And I chose to focus on this area because, I've noticed how hard it is for women to get pregnant. And, when we're younger, we just think we have sex and we get pregnant and it's so easy, but it's not like that at all. And so for some women, it's very hard and a strenuous process. So I love helping women, be more aware of their body, more aware of their hormones, and feel like they're in control of the fertility journey, because often it just feels like no hope and, they have no control over it. So that's why I chose to kind of focus on that area.
Okay, so explain us a little bit of the correlation, right? The hormone imbalance and the pregnancy issues. And a lot of women in their fertility ages, it's all over the news that, I mean, not news, but in the research, like, as many as 25% of women have problem in pregnancy, right? Getting
Yeah.
pregnant. So let's understand the correlation.
Yeah. So I mean, the main way that hormonal imbalances impact fertility is that they impact ovulation.
Mm-hmm.
And ovulation is essentially the process where an egg matures to the point where it can be released.
Mm-hmm.
And we need that to happen because we need an egg to meet with sperm so that an embryo can form and pregnancy can take place.
Mm-hmm.
And there's so many hormones that make that happen. They need to work together in order for that to happen.
Mm-hmm.
And so when one of those hormones is imbalanced, the whole thing is thrown off.
Mm-hmm.
And that can really hinder ovulation. On top of that, the same hormonal issues that can cause impairments with ovulation can actually cause an increased risk for miscarriage. So I often say, getting pregnant is one part of the story, but
Mm-hmm.
staying pregnant is just as important. And the same hormonal issues that cause um, issues with the ovulation can increase a woman's risk for miscarriage. So we need to really focus on balancing the hormones so we can address both parts of the equation.
So is there any particular, there's so many hormones, right, in our
Yeah.
body. So is there any particular hormone like estrogen, progesterone, or I mean, what goes out of balance that affects the ovulation part?
Yeah, I mean, there's so many hormones that, can impact fertility, but what I would say is that there's core hormones that make ovulation happen, and there's four of them. So there's estrogen and FSH. These two hormones work in the first half of the cycle to grow the egg to the point where it can be released.
Mm-hmm.
Then we have the hormone LH, which actually forces that ovulation to take place.
Mm-hmm.
And then we have progesterone that comes after ovulation. So
Mm-hmm.
those are the core four hormones that need to happen and be in sync so that ovulation can take place. But outside of that, there's so many other hormones that can impact ovulation.
Mm-hmm.
Hormones like testosterone, thyroid, stress, insulin. There's so many hormones that can send signals to the egg, to the ovary, and the ovary can get confused really easily. And so we need to look at the whole picture. We need to look at all of the hormones and figure out which ones are in balance.
Wow. So okay. So now ovaries, little thing over there. She, ovaries getting confused. Oh my God. this guy,
Yeah.
testosterone is coming, this guy is coming, and I don't know what to do, and I'm like going to stay right there, and I'm not going to release the egg, or something like that is happening
Yeah.
inside the body, right? I mean, just to put it in a very simple way, all this drama is happening to our ovaries here, because a
Yeah,
lot of
lots
them
of
are,
drama. Yeah.
Okay, so now this happens and ovary is confused. Now,
Hmm.
what is the framework that we need to do, women, to make sure the ovary kind of starts releasing the eggs now?
We need to balance whatever is imbalanced.
Okay.
Because remember, when one of the hormones is imbalanced, the whole thing is thrown off. So
Mm-hmm.
we need to make sure all of the hormones are working in sync. All of them are within their ideal ranges so
Mm-hmm.
that a proper ovulation can take place. There's no one hormone that we focus on. We need
Mm-hmm.
all of it to work well. And that takes assessment. We need to
Mm-hmm.
figure out, what hormones are off, and
Mm-hmm.
whatever is off, we need to fix.
Okay, so so how do you start? Like, is there a test? Like some client comes to you and they're obviously having problem in, getting pregnant. How do you start? Like, what is the framework on high end? And this is not medical advice. This is just a framework. Okay, let's start with the test of which hormone is out of balance. Then
Yeah.
we go into this. Then we go into that. What is that process?
Yeah. So the process first involves a very detailed interview, basically, where an expert, a hormone expert, should ask a lot of different questions.
Mm-hmm.
And we ask a lot of different questions because based on the hormones that's in balance,
Mm-hmm.
different signs and symptoms come up. So for example, let's say a woman's estrogen is low. She might
Mm-hmm.
notice vaginal dryness or low libido,
Mm-hmm.
or hot flashes. So I
Yeah.
would ask her all of those things. Are you experiencing any of those things?
Mm-hmm.
One by one, each hormone that I know produces certain symptoms, I
Mm-hmm.
ask about. And
Okay.
then once I get a good sense of, what hormones may be off,
Mm-hmm.
I recommend lab testing. Okay.
Mm-hmm.
And so that the lab testing almost kind of confirms the suspicions.
Yes.
A good doctor should be able to tell what's going on based on, what you tell them.
Mm-hmm.
But then the labs confirm it.
Mm-hmm.
And then once we confirm what's going on, then we can make a very detailed and targeted treatment plan to fix the situation.
Okay, so the detailed plan, what does it encompass? Again,
Yeah.
we don't have to go into each and every detail of herbs, but on a high level.
Yeah. So I usually always start with diet.
Mm-hmm.
So what I often see is that women are not eating enough calories.
Mm-hmm.
And if they're not eating enough calories, sometimes they're not eating enough protein or fat or carbs. All of those three things are needed to make hormones. And they're needed at specific quantities.
Mm-hmm.
And some women, they will just really bring down their calories to lose weight, and then they'll lose their periods.
Oh.
So I really do a thorough analysis of what a woman's diet looks like, how many grams of each thing she's taking in. And then based on what I find there, I make specific recommendations on how to increase fat, how to increase protein, because we need those to make proper hormones. And then after diet comes, lifestyle. Are you stressed out? Are you sleeping well? When those two things are off, hormones get imbalanced.
Yeah.
And then after that, that's when the supplements, the vitamins, the herbs, they come in to play. And what supplements I recommend really depends on the situation, what hormones are in balance. But in general, I believe the best thing for women is antioxidants. In any situation, whether it be fertility, PMS, menopause, endometriosis, doesn't matter. Yeah. When we add antioxidants to a woman's fertility plan or treatment plan, she gets better. So antioxidants are very, very important, and we can get that through diet, but we can also get it through supplements.
Yeah, this makes sense. And all of us, right? We want to lose those extra 5 pounds, 10 pounds, and we want to look whatever. And then we don't understand that we are depleting the nutrients from our body, and then it's going to impact in a strange way, right? To your point.
Exactly. If your body doesn't have resources to make hormones, it won't. And it will prioritize making other things, because hormones are not really that big of a priority for your brain and for your body. But other things are, you need to breathe, you need to live. So it'll prioritize those things, and then the hormonal stuff kind of falls.
Sure, sure. So what are the common herbs? I mean, this is like I said, but just on a high level, what are these common herbs that that are generally used?
Yeah, so one of the most common herbs to help balance hormones is Vitex or chasteberry tree. This herb works on a lot of different hormones, mainly prolactin. It brings down prolactin, which is the hormone that produces breast milk. And when prolactin is high, it can actually hinder other hormones from being made. So it's a big one in terms of hormonal balance. Other herbs, things like tribulus. Tribulus helps to trigger LH so that we can actually ovulate, because remember, LH is the hormone that pushes ovulation.
Yes.
And then I use a lot of vitamins. I use more vitamins like myo-inositol. Myo-inositol is a B vitamin that helps to improve ovulation through reducing insulin. N-acetylcysteine helps to improve ovulation by improving insulin. So again, it really depends on what hormones are in balance. But there's a lot of different natural treatments that we can use, and depending on what's going on, it's the best way to figure out what to use.
No, I think this is just an intro. You're doing like a 10-15 minute intro, and don't start doing all these vitamins by yourself. This is just an intro to really understand and make everyone understand that hormone imbalance can cause other problems, and pay attention to that.
Exactly.
And what would you like to summarize with?
What I would summarize with is, if you're trying to get pregnant, it can be stressful because, you're trying for a long, some women try for a few months and it doesn't work. What I would recommend is, if you feel like you have hormonal imbalances, get checked out. Because a lot of times what you feel and what you notice about your body is true. And so don't let doctors brush you off. Get a thorough analysis, figure out what's going on, and then based on that, use targeted treatment plans to help balance it, and so you can get pregnant.
No, I think this makes sense, to all the women out there. Get to know your body. We had Women's Day, right, just 1 week back, and we all try to ignore ourselves and take care of others, whether it's our parents or kids or husbands or what have you, but learn to take care of yourself, and no, don't ignore your own body, right?
Exactly. Pay attention. Your body will tell you if something is wrong.
Well, thank you so much. I think this is really informational for a lot of women out there who are trying to get pregnant and trying to figure out why the hormonal imbalance happens. So thank you so much for being with us today.
Thank you for inviting me.
Yes, absolutely. Thank
you. Bye.